Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Dr. Bojan, can you hear me? Dave. Yeah, Gunjur TV online viewers, welcome to another edition of, or another episode of Salaji Turning Point for Combo. But today we are not talking about lands. Our proposed topic actually is supposed to be about deplorable education stage. Welcome, Prof. How are you?
Thank you. Yes,
can you hear me?
Yeah, you call me Dr. Bojan, so all the Bojans should know their content.
Okay, Dave, can you hear me?
Yes, yes.
Okay, so Gunjur TV online viewers, my fellow panelists, Dr. Lamine J, Conteh, and Dave Manneh, welcome to another episode of Salaji Turning Point for Combo. But today we are not talking about land issues. We are not talking about education. In fact, the deplorable educational situation of the Gambia supposed to be our topic today. But today nobody want to hear about education. Today nobody want to hear about the land issues. So nobody want to hear about any other thing but COVID-19, because this is one thing that filled the discourse of Gambia. So that's why we changed the topic in a very, very short notice to concentrate on, what is affecting the entire nation, these past few days. COVID have been with us for like 7 months now. Gambia, we had our first case in the 17th of March, but our numbers have been very, very modest. But past couple of weeks, we start numbers spiking up to an alarming rate. And right now, I can say everything is gone down, including the website of the Ministry of Health. Before that, they lost a laptop. But today, from yesterday, even the website is probably infected with corona. So that's why we decided we're going to talk about corona today. So what I'm going to do, I'm going to give you a brief update about COVID-19, the entire pandemic. Then I will give you some numbers, supply from the Gambia Health Ministry, numbers of how they are affecting the people of Combo as well. So quickly, I'll tell you, so far when this pandemic announced itself to the world, 18,349,927 people got infected. Out of that, 694,897 died as a result of COVID-19 infections. 11,549,267 people recovered from COVID-19 infection. This recovered population, when they say somebody got infected and recovered, that means your body immune system. The immune system, these are specially programmed proteins that will specifically attack and eliminate certain infection like virus or viruses or even venoms, not venoms. So once your body, these specially programmed proteins, they overcome a particular illness or a virus, the body doesn't get rid of them. In fact, they lie in waiting in case when you are affected by a similar virus again. In that second instant, the attack against the virus is more robust, is more quick, and is more powerful. So that's what we call memory attack. So these immunoglobulins, or specially programmed proteins, can be equated to the soldiers of our governments, of nations, soldiers of nations. And these are specially programmed proteins also are divided into different regiments. You have the intelligence services, you have the marine, you have the civil defense. They all work differently, but in conjunctions. So when you recover, that means the virus cannot do anything to you. So technically, if you take somebody who recovered from the virus and fill their blood, take the liquid component and give it to somebody or transfuse it to somebody who is infected with COVID-19, they should technically recover, because these specifically designed proteins will just go right in and attack. And a similar, to give you a similar example in real life, is that when we booted the dictator out, he refused to go. And the Gambia can't trust our security service. We think our security service is inefficient, they are divided, so we need a reinforcement. That's why the economic come, when the economic come in, they flush the bad guy out, and Gambia got themselves, and they got their freedom and have their new president. So that's how this, if you transfuse recovered plasma to somebody who is currently infected with virus, this is how they will recover it. So currently, number of people who are working, they are actively infected with COVID-19 stands at 6,105,763. And out of that, 99% of that total, 6,041,123 are in mild conditions. And when we say mild condition of COVID infection, these include the asymptomatic patient. That is patients who are showing no sign of symptoms that they are infected. And these can last between 2 days to 2 weeks. You can be working with this virus, but at the same time, you are not feeling anything, but you are at the same time infective, that you can transmit the virus to unsuspecting people you come in contact with. That's the nastiest part of this virus. You can be walking around feeling healthy, you feeling nothing, but dropping this virus anywhere, any surface you contact or any person you come in contact with. So that's why when you travel from an endemic region to other countries, they put you aside for 2 weeks to make sure that if you have the virus, then they can contain it. They will test you. If you are positive, then they will give you treatment. If you are clear, then they will go. If for 2 weeks you don't see, you continue to test negative, then they will let you back into the community. But number of people currently in serious condition with COVID-19 infections is about 64,640 people. These 64,000 people are the ones that need hospitalization. And in hospitals, what they do, they give them support service. There is no definite treatment regime for this virus up to now. And today, unfortunately, today the WHO announced that there might never be a silver bullet against this virus, which is a really, really bad news, because everybody is pinning their hope on vaccination. When the vaccination is out, you can go and get your job and go about your business, and you will travel without being subjected to these long and boring quarantines. But today, WHO is telling us that might never be the case. But WHO always trying to take the safest positions, which is understandable, because for them, if they get it wrong, it can, be catastrophic. As we have seen some of the mistakes they made earlier. In fact, I wouldn't call them mistakes, because this is a new virus. Everybody is learning about it on a daily basis. But Donald Trump used that to pull America out of WHO, and also to stop funding to these very, very important institutions. So I'm going to give you the numbers of the top 10 most affected countries, and also the most affected countries in West Africa. Then I will give you the actual numbers in Combo as of 29th of July 2019. Past 24 hours, America recorded 17,459 new cases and 1,179 dead. Brazil registered 2,621 cases and 96 dead. India, which is by far on its own, as far in terms of new numbers, recorded 47,454 and 808, and Russia 5,394 and 79 dead. West Africa countries very close to the Gambia, from Ivory Coast to the Gambia. Ivory Coast so far registered 16,182 cases, and Senegal registered 10,380, and past 24 hours they recorded 42. Senegal's numbers have been definitely going down. They've been stabilized for a while, and they're definitely coming down. I call for Senegal to come to Gambia rescue, and these idiots Carter just came in and insulted me. That's one of the most idiotic statements he had for some time, which I accept, because Senegal case is an interesting one. They have one of the most the third most recovery rate in the world, and they develop their own test kits which they can detect COVID-19. And this is one area Gambia is lacking significantly in recent days, because what happened, all our healthcare personnel who are responsible of testing, they are all infected. Just before I come in here, I understand Serekunda Health Center is closed because the place is contaminated. They need to fumigate it. And MRC in itself might close because 2 days ago they have 12 of their staff infected. That is 32 yesterday. So their OPD definitely will close. I don't know how quick. So, and the turnover of their tests is about 72 hours. But Senegal have a rapid test that they can do within minutes, it tells you. So it won't, might be the way I wrote it, because I said Senegal should just take advantage of their bilateral relationship with Gambia and just march in, and set up like treatment centers, But this I think is the way. Even though our politicians are trying to cover up, but when heads start dropping, there is no way you can cover up. This is completely out of hand. The earlier our government come out and ask for external help, the better. And Guinea also was really bad, but also their numbers are stabilized in the past 47 hours. So where is we missed two people. Where is Mr. Alaji? So basically, normally I will ask you guys to introduce yourself, then we start. But I was waiting. Banka will come, and Suwaneh also will come. That's why I went in straight to presentation of COVID-19. So while we wait for these two again to come, I will give you the numbers as of 29, how Combo is struggling again. When we mentioned Combo, we said we are talking for Gambia. Combo is more than just a region. It's a melting pot, and that's where everybody is. And it's not surprising this pandemic also is Combo that is feeling the brunt as of today. I know it's going to spur, unfortunately, but as of today, they are the most affected. Sorry, these writings are too small. So I will start with Kitty. Kitty have 1, Sanyang have 4, Kunkujang have 2, Tujereng 1, Tanje 1, Manduar have 2, Brikama 30, Busumbala have 12 cases, Bafulo to 1, Farah to 3, Yundumu 3, Jabang 2, All Yundum 2, Willingara 2, Suguta Salaj 1, Brufut 2, Medicare, which is also in Combo, is 1, Brusubi 8, Brusubi, Bijilo, these are all Brufu, right? Bijilo 6, Keresering 6, and Tabo Koto 2, Abuko Lamen 15, Banjulundin 3, Mandinarin 1, Lamen Daranka 1, State House is in Banjul, but they have 3, Banjul 18. But we know a report which is unpublished, State House, they have up to 30, actually, from Cooks to close areas of that. So I'll start with Banka. Introduce yourself to the panel, to the viewers of Gunyo TV Online, and to also the panelists. Then we will start the discussion. Banka, can you hear me?
Ahmed, you are breaking on this end a little bit. I don't know whether it's me or you, but it looks like it's me on my end.
Yeah, maybe. Did you open? Have you opened it in another device?
No, I'm using my laptop, but it's okay. I think even though you break, I do hear most of what you're saying. No, okay. Look, I think this is a great program.
First, introduce yourself to the viewers of Gojo TV Online.
Oh, there you go. See, I missed that part.
Exactly.
This is Banka Manneh. I know a few of you people know me, but I'm also a Gambian. Always interested in Gambian affairs and discussing the issues, and happy to be here all the time with my man Manjang and my son Manneh, and my brother, good Dr. Conteh, and Sawaneh has joined us today. So I'm really excited to be here with you all as always. Thank you very, very much.
Mr. Ebrima Suwaneh, welcome to Gunjur TV Online for the first time. We know we're going to get you. Well, we've been, talk behind you, but we decided to use Dave, to work on you. So welcome. Introduce yourself to the viewers.
Yes, my name's Ebrima Suwaneh. I'm a Gambian myself. I trained in Gambia as a nurse years ago, a couple of decades back, and briefly worked over there for about 6 months in a couple of health centers, Serekunda Health Center and Brikama Health Center. Three months in each of these health facilities. Then I moved to the UK, and since then I've done various trainings, and now I work in a major trauma center, one of the busiest health facilities, NHS Trust in the UK, called Leeds Teaching Hospitals. So I currently work in operating theaters. So we deal with all sorts of major trauma cases. So this is me and my experience in a very, very brief summary.
Okay,
so I'd just like to add, sorry, if this is the first time for me, so you guys probably already picked up I'm a bit nervous. I've never done this before.
So you're going to be Dave told me he's not very good at talking, but now he's addicted to it. He's my mentor now. Okay.
I'm open to ideas, and I want to learn from you guys.
Feel free. Take your lead. This is like Badimbung. We are having a Badim conversation. You know what I mean? So
and also very short. It was very prompt for me. He informed me about 30 minutes ago. So I thought this is crucial time. So desperate times require desperate measures. So I made every effort to try and be present here with you guys.
In fact, our topic's supposed to be about education, the state of the state of education in the Gambia. But, we know nobody wants to hear about education. It's about life and death now. So that's why we changed the topic in sub-notice. Banka also here at that night, and Prof. Conteh also here at that late, and even Dave also here at that late. But the original idea to change it come from Prof. Conteh. Prof. Conteh, introduce yourself to the viewers of Gunjur TV Online.
Yeah, well, thank you. This morning when I saw the mayor of Banjul crying, I just felt that we should try to talk about the pandemic in the country. And as he said, people are dying, and he called on several people in the country to help by name. And education, we should just put that in the backbone. And in fact, I was very touched by a couple who died, 1 day apart. And someone just told me that their friend also died today. So I'm not a medical doctor. I teach accounting and finance. So I will leave this up to you all, because I think this is very sad, and there shouldn't be any politics on this. We all should find a way to solve. So I will let the medical people address the issue. And I'm blessed also to be around the Mane Kunda Kabilo. I guess they ate their mungo today, or maybe so I know that there are too many what do you call Kabunkas here, and they should come to the rescue of our country. And Mrs. Sawaneh, are you keen to a gentleman from Sami constituency? I will say his name. Oh, yeah, okay, good.
I'm a Komoko from Mandinare.
He's from Mandinare, yeah, it's our neighbor, yeah.
Okay, good. So I just want to let the professionals talk about this, because this is very critical for our country, and if we can find a solution, it will be very great. So I stop right there.
Okay, so Mr. Sawaneh, already the viewers are picking on you. They said Ebrima Jani. He said, thank you, Ebrima Sawaneh. He is my brother and friend, highly disciplined and dedicated and well educated. Welcome, Mr. Sawaneh. So he's one of our regular viewers. He's saying that to you. Okay. how do you call it? Dave again. Dave, introduce yourself, please. We enter into this discourse. These are not about medical discussion. This is about how the pandemic is impacting on the daily life of the Gambian people, and how we can get them to do the simple things that we can prevent us. Dave, go ahead.
Yeah, I'm DF Manneh. I think I'm becoming a permanent fixture here by now. Yeah, when we first began, I was like nervous, like Ibrahim is today. Because I'm not the most eloquent person in the world when it comes to verbal speaking. But I think I've made some slight improvements in the past couple of. Is it 10 weeks now? I couldn't believe it. It's a milestone, really. But then again, I'm just very grateful. My friend, my school, Ibrahim and I we go way back. We went to high school together. And then we used to hang around together as well, because I used to live in Yundum. Ibrahim's mom is from Yundum. So we have a relationship going back a long, long time ago. And in the early to mid 90s, when we came to England, we also came around the same time. So that friendship has still been there. So he's my brother. So I've been trying to drag him into Cowboy Rakafu for a very long time. And a few months back, eventually, I succeeded. And then I've been trying to get him on this platform as well for you on the panel. And then eventually today I did, because he hasn't got a choice. He's obviously a medical professional. And like Mr. Jani said in the commentary, what's he called? One of the guys who commented, Ibrahim is very disciplined. Yeah, he's a really nice guy, very genuine. Like I said, I consider him a brother. And he's also related to me, by the way, because he's also related to the Manehs in Brufut. So, some of the Manehs in Maninaring and the Manehs in Brufut, we all one family. So he's also related to me. You wouldn't believe it. I mean, well, we should believe it anyway, because that's how interrelated Kombonkas are. But anyway, to make it short, I am actually very pleased that he's here. I'm trying to get him involved and very active in lots of things, because he is somebody very versatile, and he's also got the patience. I think he's somebody Kombunkas and the Gambia could do very well with utilizing to the very maximum. That doesn't mean we have to use him, but basically to utilize him. So I think there's a distinction between in the two words there, and I'm sure he appreciates that as well. So that's it. Dave Manneh from Brufut, live in the UK. I'm here doing a little bit of social commentary. Like Dr. Conteh said, this is not our field. We're not professional, but I'm sure we've done some observations and we can probably be able to speak, but don't expect that it's going to be too deep anyway. Okay, thank you.
Yeah, thank you very much, the panelists. How we're going to go about this, 2 questions I put down. Are we already in constitutional crisis because of this pandemic? And also our healthcare system is broken down, going to get out of this. So, but before that, I will give a brief description about the virus. What is virus and COVID? And then I will ask Mr. Sawaneh to, maybe these clinical symptoms and the management quickly, maybe in 5 minutes. So virus, I don't know how the IT guys, their understanding of virus. Well, virus is you can say it's not a living, it's a living thing, but the most accurate description of virus is a borderline between life and death. Outside the living things, it's not alive. You can call it alive, maybe after a couple of days, a couple of hours. In fact, for some of them will become crystallized. But once inside a living cell, what it does is it hijacks the cell replication machinery. It hijacked that and trick it to multiply more of its kind. So, but that goes in different stages, like attachment, how it gets into the cell. For this particular virus, COVID, it needs a specific receptor. This ACE receptor is not created for the virus. It's for some enzyme that are responsible of the regulation of the heart. So it actually hijacked that ACE receptor and get in. Once inside, it triggers the cell replication machinery to produce more virus, and that also goes in the different stages. That means on coating, it needs to get rid of its sat, and all that is regulated by pH, temperature, and everything. So why the controversy about chloroquine? How can a malaria medication work for virus? The only common denominator there is Malaria is an intracellular parasite, and virus also is an intracellular parasite. So for the virus to be able to uncoat, to get rid of its shard inside the cell, it need an acidic environment. So what chloroquine does, it makes that intracellular space is alkaline. So once that is alkaline, the virus is confused. It cannot do anything. So um, just to clear that bit, but there is a lot of controversy about chloroquine. I'm not going to go into detail about it. So virus is a borderline between life and death. Once inside the cell, it hijacks the cells, and also they are specific, the kind of cells they attack. That's why you have the hepatitis, cytomegaloviruses, depending on which area of the body they attack. These particular viruses have a predilation to respiratory tract tissues. But what, as I said, anything about COVID is fluid. Still, we don't know a lot more about this virus, because these ACE receptors, initially we think they are only concentrated in the lungs and the nose and all that. But later discovered that you're actually in the brain as well. So it can have some psychological issues as well. So basically, once inside the respiratory tract, it gets into your lungs. Your lungs mount a defense against it. So basically, what happened? The defense against the virus overwhelmed, like the body overreact, to itself. That will develop what we call a cytokine storm. So this overwhelm the body, and the inner lining of the lungs start damaging. So once your lungs is the inner lining is damaged, your body cannot take in oxygen into your system effectively. So, and the concentration of oxygen in the atmosphere is only about 21%. So if your lungs capacity is like 25%, it's like it can only take 4 of that. So to maintain 75%, which is the healthy oxygen concentration in the blood, it's not possible. So that's why when those in critical condition or are very sick are taken to the hospital, they supply them concentrated oxygen. So to offset that deficiency in your lungs, so they can maintain healthy concentration of oxygen in your system, so that your other body parts can work properly. Because if the oxygen concentration goes below normal, your other vital organs start failing, because they cannot work properly. So this is how virus eventually kill us. Your vital organs start failing, and somebody who cannot have proper oxygen. We've seen report of this in the social media. But why oxygen? Why everybody is talking about the ventilators? And why countries are asking how many ventilators per capita we have. So these are issues. I heard there is 3 working ones in the Gambia, which I can almost they are all taken by now. Especially if you have to share with the Chrysler Tutores or the Lime Boys, so probably is all taken. So this is just a brief description to give you a brief idea what virus is. Virus have no use. It's just that now technology is so advanced, they can be engineered to actually deliver certain kind of vaccines into the cells because of their ability to infect cells. But other than that, they don't have any use like bacteria. Bacteria have lot of uses, we can employ in our daily life. But for virus, they only good at causing havoc. And also they have virus that are specific to animals. We have virus that are specific to human beings, but we have virus also that can escape, that can cross the species barrier, like this corona one is. That's why they are called zoonotic. That is, they can jump from animal to human beings. So Mr. Sawaneh, welcome to the show. Baptism of fire, just the normal. If you have a COVID, what are the things you should be looking for? If you have this, you should suspect.
Yeah. So COVID, like you've just given a fantastic, very detailed description of the biomedical side of it. Like you said in your audio, in your speech there, COVID is not well understood, and COVID-19 is still changing every day, literally on daily basis. New ideas, new new ways of dealing with it come into effect. So COVID has many symptoms. So some of the symptoms, the classic ones are temperature. You get high temperature when you have COVID. So your body feel warm to touch, in basic terms. So you can also have cause a coughing fit. So you could cough like continuously for a short period of time, and this can be recurrent. It is also known to affect people's taste. So you could have loss of taste, sense of smell will be affected as well. And also it can cause diarrhea. And any infection, any form of infection can cause headache. So these are the classic symptoms of COVID. So it affects your breathing, like you just said, and people can have labored breathing. And when that happens to people, usually they panic, and it makes it worse, literally. So in summary, these are the classic signs of COVID-19.
Okay, thank you very much. So if you persistent cough, you have temperature, you have headache, very likely you have COVID. But on characteristic symptoms like loss of sense of smell or taste, all of a sudden you can't smell your benachin and you can't test it, and there is no other condition, most likely you have to call your GP. And there is other not very common symptom called COVID toe, whereby you have a scratch on top of your toe and you scratch it and it develop into an open wound. And also now I've seen one last week also inflammation of your tongue. You see these rashes on your tongue. So these are all not very common. So that will get us into the main discussion. Now, Banka, we have Dr. Isa Tuture tested positive. The Speaker of the House had been ill for close to a month now. We don't know what kind of illness. I'm not sure if it's COVID or not. And we know a lot of tests have been done in the State House. According to the report, I gave you 3 positive in the State House as of 29. But there is no announcement if the president is positive or negative. Do you think we are in a constitutional crisis?
I would not describe it as a constitutional crisis per se, because when you talk about a constitutional crisis, that means there is a potential situation that has arisen that points to the idea that we have a situation where the constitution in of itself is on the line, and yet there is nothing, or don't seem to be any solution in sight. That's when you say there's a constitutional crisis. But then, the president, until when we know what happened to him, until when we know the vice president cannot perform any functions or any duties as far as the state matters are concerned, until we know that the Speaker of the House literally cannot function at all, her situation is that grave, until we know that the next in succession from that person, because there is a line here that is literally stipulated by the Constitution. Unless you go through all that line and realize that there is nobody there in the end to fill in the post, that's when you will have a constitutional crisis. But what we do have, though, is a serious period of uncertainty beginning to set in. And that's that even is a threat to the Constitution in of itself, because it is what gives rise to the constitutional crisis you are alluding to. So what that means is the government must, be very open with the people, communicate, have a conversation with the Gambian people as far as what its plans are, what is happening, what they are doing about it, what we should expect. In other words, manage our expectations in that regard, and also make sure that whatever resources that we have available to fight this scourge, those resources are all deployed, and we are not sitting there trying to look at it this way or that way. When I say look at it this way or that way, meaning politically, we are giving it all those kinds of considerations. This should be fact-based, evidence-based, based on guidelines from the World Health Organization, credible institutions. What they are advising governments to do around the world is what the Gambia government must sit down and hunker down and see how they can devise strategies around those recommendations and enforce them fully to contain this situation. Because if we don't, then obviously it becomes a threat to national security in of itself, because it does give rise to uncertainties that can threaten the very constitution and creating a situation that you alluded to, like I said. And also the very national security of the nation is going to be at stake, because when people's lives are begin to get threatened in the way that this thing can threaten a nation, you don't know how the population will react to that. And you don't know what could potentially happen in that kind of situation. And so you have all kinds of implications here. And so the government must come out, Barrow himself, and I've been yelling about this from day one, that Barrow should communicate with the government people. Now, in the current situation, like you said, I don't know what's happening. Is even possible, considering what we have seen happen around him. That is, the Minister of Finance is already confirmed to be positive, the Vice President positive, even the Imam of Banjul is confirmed, as we have been told, is positive. And in other words, people who generally will congregate around the president are all found to be positive already. So, I mean, and the president is gone AWOL. In other words, we don't know where he is. We don't know what's happening. So it's safe to assume that the man, they told us he's in quarantine. But if people can speak to the people even in quarantine, that shouldn't really stop you from communicating with your people. You can have a video conference and with all the precautions put in place. So this is not like, I remember, what's his name again, the CNN guy, Como, when he was when he had COVID-19, it didn't even stop him from doing his TV program. He was still doing his program. So that shouldn't stop you from communicating with the people. Now, if you have gone AWOL and nobody knows what you are up to and what is going on, then we can safe to assume that maybe the man has COVID-19 and we are not being told. And what needs to happen is anything that is happening in the government, anything that's happening with the president, anything that is threatening the national, the nation at this point, as far as this COVID-19 situation is concerned, the government must not hide that from the people. It must communicate, because all of us together, this is past politics now. I'm not in a political mode. I don't want to participate in politics. I don't even want to discuss politics, who gains, who loses, whether NPP has this or whether UDP or NRP or this or PPP has that. I don't even want to hear any of that stuff. What I want to hear is, as a nation, what is our national plan? What are we doing as a people together? And how do we intend to fight this disease together and bring it under control and get ourselves out of this mess? There will be enough time for politics. There will be enough time for all the blame game. There will be enough time for a lot of other things. For now, the president, the government must step up to the plate. Let Barrow lead. He is the president of the Gambia. And you cannot do it by hiding, by being quiet, by not really standing and talking to the people, because in that situation, you are beginning to act like Nero. And we also have seen what happened to Nero when he sat down there playing his flute while Rome burned down. That is never a good thing at all. He needs to understand that the Gambia is burning down as we speak. People are getting infected. We are hearing news that are very disturbing. Dead house full, Serakunda General Hospital shut down, places. All kinds of news that will scare the hell out of anybody. With that kind of situation, we can say figuratively, at least Gambia is burning down. So the president cannot afford to be hiding somewhere and not coming out and speaking to the government people with a view to making sure that he addresses their concerns. I think this is very critical at this point, Manjang.
Yeah, thank you very much, Banka. You conclude there is no constitutional crisis, even though we are teetering around that. And also you call the president need to come out. If he is positive or negative, Gambians need to know. If I am positive or no, nobody cares. But this is Barrow, the president of the Gambia. David, what's your take on that? The silence from the State House after we know the Minister of Petroleum, the Minister of Agriculture, the Minister of Finance, the Vice President, the Banjul Imam, I heard about that just now. These are people that are very, very close to the president. They will see him, in a day or a couple of times. What's your take, about this teetering around the constitutional crisis and the uncertainty around this seat of power?
Yeah, thank you very much, my brother Ibrahim and my dad Banka, and to yourself, for both you and Ibrahim for giving us the medical the biomedical perspective of it, and for my dad, given the political, what's happening back home. I know this is not political; it shouldn't be politicized, but I don't think we can move politics out of this, because I think what we can see right now in the Gambia is like a country that is leaderless, a country that is rudderless. It's got no rudder right now. Really, it's quite unfortunate. But even if we just maybe we should cast our mind back just a few weeks or even few months before we got to where we were today. We had some warnings and we had some time, and we should never forget that. I understand people's hesitance to try to politicize this, but it's a political situation. Our health policies are political, unfortunately, because they are the overseer of the health of our state. From the institutions to people's health itself is governed by what? The Ministry of Health. So politics can never be divorced from it, especially in the country like the Gambia. But if we cast our minds back, I think we had some opportunities. We could have done something about this, really. I mean, you couldn't say you can foolproof yourself or protect yourself from COVID. I don't think that's possible. But we had some time whereby when it was devastating, it was wreaking havoc on the West. Africa was spared. And countries like the Gambia, that's where you should sit back and think and basically even do some modeling. You can do statistical modeling. I'm sure medics do this all the time. And just to see and to gauge in the worst case scenario, what's going to happen in the Gambia, prepare yourself. But our people weren't even prepared. So it's just so a few days before the Eid, thousands of people crashing into each other in Serekunda market because trying to rush to do last minute shopping. It's called Wantero. That is just very irresponsible. So we can never divorce. That's politics. That's political decision. That's poor governance. That's poor administration. We can never divorce that from the situation that we are facing in the Gambia today. So you were talking about you hinted about how Senegal could come to the Gambia's aid, and then people got all emotional because we always do this. I mean, Senegal, they are our neighbors. We are very, very close to them, but they are much more organized country than us. We just need to admit that. And not only that, internationally, they are much more prominent than the Gambia. So they got the Pasteur Institute in Dakar. It's a twin of the one in Paris. It's world ranking. I mean, you guys are in the medical field. So the Senegalese were able to innovate these tools, handheld tools, whereby they could even test COVID-19. They had that before the UK. And Ibrahim probably will be able to provide more information on this. But I know even our NHS at one time were trying to contribute towards that innovation in Senegal because they were so impressed by it. So it just shouldn't be outrageous for anybody from the Gambia to suggest that Senegal could come to the Gambia's help. What's wrong with that? Yeah, they are bigger than us size-wise. They have a bigger economy. They are actually much more organized than we are. So they are not best. They have also got a long way to go. But it's nothing working in hand with the Senegalese. So I see no problem with that. I mean, if the West have seen what Senegal could do when it comes to testing and some of the innovations they've come up with during these past 6 months. I mean, since this COVID wreaked havoc around the world. I think it is something we should all be very impressed by. And that's this nationalistic, this minor and selfish and society nationalistic. I think we need to move that to one side. But I am just going to say this once again. I don't want to make this too long because my comments is going to be more like social commentary. And I can't help that, unfortunately. But I think we're not blaming anybody. It's not politics. I'm not much political. Obviously, I have a political party I support, but that's right here, not there. But our people, the Gambia government had a chance. They have some time. They could have been prepared. The situation, the Gambia should be in a better position than it is today. And worst still, I'm saying that for me, again, you guys are the medics here, but I think it would have been very important and for the Gambia to consider any death that's happening in the Gambia right now to assume that it's COVID-19 related, so that we have specialist people to do the burial. So you don't have the families coming to see this dead person And all these ritual rites where people have to come up from all over the places, the families and neighbors and loved ones having to come and pay their respect. I think that all need to stop right now, because I think it's not helping. And earlier on today, somebody sent me a video of a guy who lives in America. His brother passed away in Joshua. And you see the amount of people there, everybody rushing. I mean, what do you need to do this? I mean, you see the guys from the Red Cross, they are well properly suited. They have their PPE kits on, which I was very impressed by. But then you got all these people coming over. Well, they're thinking they're paying their respect. You're not paying your respect. You're actually endangering yourself and your neighborhood. So I think this is where our government is failing. And we have to say that that's not politics. The government is failing because we come from a country, institutionally, we are struggling. We don't have the infrastructure that should help us. So for us, that should have been where we should start back and be prepared. It's like, look, if worst comes to the worst, what's the worst case scenario? We are unable to cope. Like you said, they don't even have the machines. The other day I had Dr. Abdul Karim, is it Kamara? The guy used to be, in London, but now at MRC. The lamentations he was making on Peter Gomez's program, it moves you. It's quite sad. Gambia is very, very helpless. Gambia is helpless. The thing is, you need to be like a Boy Scout. You need to be prepared. We are not advanced. We don't have an advanced economy. We are not advanced scientifically. We're not economically powerful. So what do? You prepare yourself. We had some time to prepare ourselves. We didn't prepare ourselves. So even when COVID-19 came, people weren't taking this thing seriously. So we find ourselves where we are today because of poor leadership. There is no two ways about that. So we have to say that. Really, it is. It's still not too late, but we would like to see more movement and quicker action from the government. And the president hiding away, nobody knowing where he is. Basically, it gives a perception of a whole group of people in government who don't know what they are doing. And that's the case. And that's the honest truth. I mean, you might have prostitutes, you might have the MRC as an example. And even some of the private health clinics, they're doing their best. But when it comes to government oversight, it's absolutely missing. It is missing. You know it, Mr. Manjang. My friend Ibrahim knows it, because this is your background. We are not comparing Gambia to England or Gambia to Saudi Arabia. That's comparing apples and oranges. It would be ridiculous. But at least the basic human decent thing they could have done, really to prepare at the very, very least, is to get our people informed and be very strict and enforce the laws. The laws are still very lax in that country. If you can have hundreds of people attending someone's funeral, someone who is not even suspicion, is actually confirmed that he died from COVID-19, that's a failure of leadership. That is a failure of leadership. I hope I'm not being very political. I'm sorry.
No, you're not. That's what this conversation is all about, to have honest conversation about the status of this pandemic in the Gambia.
But Ahmed, let me add something to what Dave is saying there. So I totally agree with you. When I said political, I wasn't even referring to as in not blaming the government.
Partisan
politics. Exactly. I was talking more in terms of not the partisan political kind of jockeying that I've seen here in the United States, where it became politicized to a point where we cannot even deal with it. But my political meaning, as far as what you said about the government and Barrow's own reaction to this, you are 100% right. All these problems, we are in the mess that we are in today because of poor leadership, because of Barrow's ineffective leadership, and because he doesn't. I don't even know he knows what he's doing. If you ask me, I don't even think he's refusing to. I think the guy is just clueless. He doesn't know what he's doing. So I totally agree with you. But I know right now, I don't want us to focus too much on that right at this point, because we've mentioned that's already enough. What we should do is, I'm thinking we need to come together with a view to really, how do we now dig ourselves out of this mess? There will be enough avenues to punish Barrow for what he has done and to deal with it in the most appropriate fashion. But if we right now are going to keep continuing to say, well, it's Barrow's fault, then we are already going to keep insisting on the same old methods that have already gotten us in the mess that we are in already. Barrow's lack of leadership and his failures is already a foregone conclusion. I don't even think there is any debate or even discussion about it. And who to blame? Absolutely 100%, the government and Barrow himself. No doubt about it. I wanted to make sure I clarify that, not to sound like I'm saying political meaning we cannot blame the government for the mess that has happened. No, we must. Absolutely.
Okay, Ahmed, let me just, if you don't mind, please, let me just jump in.
No, go ahead.
Thank you so much, Dad. You don't normally follow your dad when he speaks. It's not very good. But yeah, just to clarify,
this is social media.
It's social media, but we still got our culture. We still got our culture and tradition.
I know.
Yeah. No, definitely, Dad. I agree with you completely. But I'm just saying that we still the leadership is still lacking. That's the problem. The leadership is still lacking. So, like you said, Barrow might be inefficient, Barrow might be incompetent, he might be out of his depth. I agree with that completely. But I think that's why having structures in place are so important. I keep on telling people, I say, even from our local level, from alcaldoship to the mayorship, like Brikama Area Council, the nightmare we're facing there today. And these are all interlinked. Brikama Area Council's poor governance and the central government poor governance, the two are interlinked because it cannot just, it's no disconnect there. The two are just, they're inseparable. So if we don't have structures in place, we're always going to have problems like this. So the personalities wouldn't even have mattered. And then again, I'm going to use Senegal here as an example. You see, the Senegalese, it doesn't matter which government is in power, that state always functions. Because for a very long time, and you can thank Senghor for that, I'm so he's also had his weaknesses anyway, but he was able to institute a proper government in that place whereby all this Mansaya and Guria, he put them to one side. The Senegalese understood from the time, even when they were colonized, even when they were French colony, they were sending their people to go to the representatives in Paris. So that's why they have député. So even our own political language, say député, we brought that from the Senegalese because Senegalese like people like the man they named the airport after, Blaise Diagne and others, and even Senghor, they were MPs for Senegal in the parliament in Paris. So the Senegalese were very, very well acquainted with how democratic politics works. So when Senghor came into power, he was able to institute this and he was able to separate politics. What's he called? How you call them again? Technocrats. He was able to set up a government whereby it's run by technocrats. You have politicians making their politics, but all their policies, they had technocrats doing them. So they had this undergirded by non-political people who their focus is how to make their nation state function. And you can see it up to this day today. So this is why sometimes when you compare Senegalese to, I'm not a historian, but I have a very good friend, Dr. Ebrima Suwaneh. Sometimes I have a conversation with him and I learn a lot from this guy. And then you can compare Senegal to, let's say, other countries around the area. They relatively do better than us because they had this foundation whereby their people know that the power is in their hands, not the president. And they all still, to this day, the Senegalese are able to force their government to act. We are unable to do this in the Gambia. So when we had Jawara, as I'm saying, our issue cannot ever be divorced from politics. We are very historical or it's contemporary. So when we had Jawara, we had this Mansaya mystique all about him. Oh, Mansala, blah, blah, blah. He said Jalia, Jalibur. And the man thinks that he was there, is the incarnation of Sunjata Keita and Mansa Musa. When we didn't need this, we needed somebody who should build civil bodies for me, civic organizations for us. Our people can get civic empowerment. They didn't have it. They didn't have even understanding of what it means for them to be a citizen in a modern democracy. So we are actually going. So that's why we still haven't got the foundations. Basically, I don't want to ramble on too long, but we don't have these foundations. These structures are in there because of this, because of the lack of structures, we don't have the infrastructure either. So our everything goes back to poor governance, and it goes back to our history since the First Republic. And until Gambia can fix this problem, our problem never goes away. Because we just trying to rug it under the, push it under the rug and move on. No, we have to go back to the basics and try and fix our problem. Really, that this is it. So whether it's Barrow or is even me from Brookwood, if we don't have the structures there, it wouldn't matter. The personality is insignificant. You have to have proper structures in place. It's lacking in the Gambia. It's so blatantly lacking. You just look at it. I mean, like, what is going on? It's like nobody right now. Nobody is in. Nobody is in. What's it called? The Gambia is leaderless right now. Yeah. So even if Jawara was real, even if Barrow was really bad, if we had a proper structure in place, we wouldn't have this problem because the place would function, but it doesn't function because there's no distinction between technocrats and politicians. It's no distinction. So it's a major concern for us. We have to go back to the drawing board and start from scratch if we are going to make any progress in that country. Thank you.
Yeah, thank you very much, Dave. I can tell you, rambling, and you even come back to my initial question to your dad. That is, are we in a constitutional crisis? But you went a little bit further, and also I'm happy you went on and dilate on why I call for the Senegalese to work in, because if the Senegalese are going to wait for our government to ask through diplomatic means to come and help, everybody will die because they're not even admitting, even though they are dropping by every day. We don't even know if they have it or not, but the indications are State House is seriously infected. So if we're going to wait for those people to admit that we have a problem to call Senegal, that's going to take a while. And also you say, yes, Senegal, Gambia have to accept that. This is all how the damage colonialism did to Africans. You look at us and Senegalese, if we don't talk and we start our slangs, you will know whether the guy is a Senegalese or not. We eat the same food, the same culture, the same people. They are more advanced than us. They are more organized than us. So Gambia can benefit immensely to work closely with Senegal. And there is not a better time than in this pandemic. Here is a country, they have their numbers big for like 6 months when our numbers start getting up in the past couple of weeks. But Senegal they managed to control it. And I was telling Gambians, our numbers will start going up anytime Senegal relax their internal measures. And exactly that happens. Senegal past month or so, they start relaxing their measures. People start going to the mosque. People start moving about from one region of Senegal to another. So when they reach Gambia, there is no stopping because our borders are not being controlled. So this is what is happening. Senegal have their own test, which is the turnover number. Time, that's what Gambia need now, to do a test and know it quickly. You don't have to wait 24 hours, 48 hours, 72 hours. You don't have to wait. We need to know the test result now. If they are positive, we isolate them, take them to treatment centers. If they are not, we let them back into the community. I'm going to come to you, Mr. Suwaneh, to give us the options, what we can do medically to get out of this. But before that, I'm going to Professor Conteh. What's your take so far of how the discussion is developing?
Well, I want to go back to what Dave said about Senegal. Actually, the chieftaincy posts were relinquished or disbanded in Senegal after independence. I wish we had done the same thing, because then we wouldn't know, we wouldn't be talking about save for young, save for young. And another one here is that Senghor actually set the foundation of democracy in Senegal by resigning. And Sadauda stayed in power for what, 34 years? And Yahya came in for 22. So again, what I'm concerned about is the per capita infection rates in Banjul and other areas. I would like to know the per capita deaths also in those areas. I'm making a suggestion, that actually travel should be banned and no one should actually go into Banjul. Because you're right, we have porous border. People coming from Senegal, northern Senegal, coming in through our ferries. No one knows who has what. And then at the same time, people are traveling from one region to another in the Gambia. No one knows what. For the life of me, what I don't understand, how can you be a hospital administrator and you cannot even account for, you don't even know whether you have oxygen available in the hospital. And now the most frightening thing that you just said was that they said the Serakunda hospital or the clinic is closed. So then if that is the case, how about people who are infected? Where are they going? Well, some people are saying that if you go to the private health clinics, they charge you about $1,500. So people almost
Up
everywhere,
to 2,400.
2,400.
If you want to know your status, up to
Oh,
yeah.
thank you. So if you want to know your status, where are you going to get the money? So I am for the fact that Senegal should come and assist us, because we actually use the electricity anyway. So if we are too pompous to say that we don't want Senegal to do this A, B, C, and D for us, then we should say cut the lights off. We don't want Senegalese electricity. So right now, at this moment, uh, I don't even know what is going on in the country, because if you cannot hear from the president, you cannot hear from the Minister of Communications, the spokesperson for the government, you can hear from him, and almost everybody is infected. Uh, in fact, when the late Imam of Serakunda died, the vice president is an in-law to the Imam, and I was very concerned that as he went over there, and no one even knew whether the Imam also died of this corona. And now you're telling me also the Imam of Banjul also is infected. So what is going on today shouldn't be based on blaming. It should be based on actually trying to motivate Gambians to come. But what I don't understand, why are we freely moving in our country? You go to Serakunda market. I talked to a young man yesterday. He said he was shocked about people bumping into each other in the market. And it's just life as usual. People don't care. And again, you're right, Dave. Someone who dies, and then you see the people coming down from Red Cross in their nice gear to bury the individual. Why should we be out there sitting, congregating with each other? But how about for some of us who are from the villages and towns over in the provinces? Do we know the people who died? Do we know whether they died out of corona? And then the folks who are going to bury them, our people don't even use any gloves to bury. So as a matter of fact, sometimes when they go to the graveyard, they take their shoes off. So this is very frightening. So I think we should call on our people. And for us in the West Coast region, Brikama administrative area, with the problem with Sonko and his whether he's to stay in or he's to go out, leave, and so forth. So we don't have any way of. But what I'm saying, is that if you have a family member in the Gambia, please reach out to them and tell them, particularly folks who have pre-medical conditions. We have a lot of hypertension in the Gambia, and you think about the dust itself, because if you are in Serakunda, you all the way down to Brikama, you know what you inhale, and to have those things in our country and not hearing any government spokesperson speaking today is very depressing. And sometimes we have to say it like it is. This government really has failed, and I don't know what we're going to do. And let's hope that the next 24 hours we won't have alarming rate of deaths and infections. And if that's the case, may God help us as Gambians.
Okay.
Yeah, thank you, Doctor. You mentioned two things. You want to switch off one of the devices. One of the things you mentioned and Dave mentioned, I forget to highlight, is about people congregating in these funeral grounds. Actually, there is a law, this emergency law they brought up, not in more than 10 people. But I've seen in this funeral, hundreds of people converging. Where are the police to enforce that law? This is where the government need to come in. That's where we cannot afford. We have to mention them, because somebody should enforce that law. If you bring a law and it's not being enforced, there is no point. And one thing also you mentioned, even from the medical side, I was never thinking in that line, is the air pollution in this Serekunda, Banjul, the dust, the CO2 in the atmosphere. This actually inflame the lining of our respiratory tract, and thus you can be considered as an underlying or confounded factor. It can make people vulnerable. So these are all issues why Gambians should be very, very worried, because this can make us more susceptible to these kind of illnesses. So coming back to you, Ebrima, you in England, one of the most affected countries in the world. Again, England problem start is a political issue. What they plan to do was to rely on herd immunity. That let the virus come and affect us. Few people will die, and the rest will survive. And when they survive, those one will create a herd immunity for the rest of the population. So, but then the London school came with that report that if you did that, up to 250,000 people will die, and eventually they went 360 and implement mechanisms. You know, they built a hospital, one of the biggest in the world, in 9 days. We've seen that. You know, and they turn it around, even though the numbers are not looking good if you compare them to other part of the world. But what do you think Gambia can do now? Because we are in a serious trouble. What do you think we can do medically to get out of this situation?
It's going to be difficult now, I think, because it looks like it's gone out of control now, from what I can see. I don't have concrete report from Gambia, to know exactly what's happening.
You will never get concrete report. They already lost their laptop, and
Honestly,
their website is down for about 4 days now. So you
honestly,
never.
it's unbelievable. How can a whole government department rely on one laptop? This is unacceptable. We can't allow these sort of things to go on.
That's
Even
Gambia for
people
you.
with mobile phones, people living in their homes, kids, teenagers know how to back up their information. You go on cloud, you save information. These are important, especially it's been touched by Dave Manneh there, because this data is what you use to analyze the impact of this, or the direction of how these diseases are going, and then you can come up with a plan to change the direction, or treat it. In fact, they are very good in medical modeling. This data is I can't emphasize the importance. But I think at the moment it looks like we're losing the battle. Panic's is setting. Politicians are coming out. People are crying on the streets. Because they're worried. But what that is showing to me is they have failed in their health promotion measures. The health promotion requires the recipient population to comply with your message, and nobody seems to be complying with whatever information they're sending out to them. So something is not going right. You know, what can they do? I mean, maybe they need to ramp up or change the tactics. Sometimes you guys have touched on the lack of leadership. That, I think, that is a very important thing. Our president is in hiding. He needs to come out and lead this. If he can't do it by himself, at least he needs to have a competent person by his side. Just his support to show that he's leading, his concern, and he's trying to do something about it will be motivating in itself. But he's in hiding. That shows that maybe he's given up or he's failed. So people are not bothered. People think he's not bothered. Why should we bother? Maybe that's the mentality. I don't know. But the health promotion side, in my view, need to be ramped up again. So hand washing is the single most important aspect of preventing any disease. So people need to wash their hands all the time, before and every contact with people, because we don't know who's got it. It's in the community. There's no mass testing measures in the Gambia, so we don't know who's got it. But all indications show that a lot of people have already got COVID-19. The fact of the matter is, a lot of people will be infected. This is the trend in every country that suffered from COVID-19. A lot of people get infected. Most people will have mild symptoms, but the vulnerable people, the elderly people, they are at risk and they will die. You don't take it lightly. I have personal experience with colleagues who have died from this, and some have been on ventilators for weeks, and some pulled out fortunately, but others didn't. This is the reality. You can't take this lightly. Maybe they need to shock the masses into some sort of compliance, by showing live videos of people who are affected by this disease. It's a very nasty illness. I am not going to digress on the political side, because I'm not very versed in Gambian politics at the moment, I have to say. But hand washing is the single most important, I would say, element that we could all emphasize. So face masks help, because it's spread by droplets, so you have humanly contact. When you speak, when you sneeze, when you cough, the vapors don't escape into somebody else's personal space and they're inhaling it and contacting this illness. So face mask will help. Don't touch your face. I think that's the best way to advise people not to touch their faces, because your face is full of orifices. There's a hole in your ear, your eyes, your nose, your mouth. All these, they emit secretion. So these secretions could transfer this illness from one person to another. So don't touch your face. If you do, wash your hands thoroughly with soap and water for about 20 seconds, no less than 20 seconds, shall I say. If you cook your food, cook it thoroughly. You go to the market, you buy your vegetables. You need to make sure they are well cooked. Your eggs, your meat. So that's very important as well. But when it gets to when we fail in the health promotional aspect and people start getting affected and ill with this disease, then it's inevitable they're going to seek to go to hospital, the health facilities where they think they're going to get treatment. And I have said this and I've wrote this in social media. I know for certain where I work, when this started, it started in southern part of Europe. These people, they work together. So in medicine, you have to work together. You have to coordinate. So to have to say that we can't seek assistance from Senegal, that's stupidity. Really, we need to work with the Senegalese and anybody else for that matter that could help, because it's a crisis level. So they've learned from what's happened in Italy and Spain, and it is dangerous. It nearly collapsed. The health system in those countries nearly collapsed under the pressures of the COVID-19. And if that happens, that'd be a disaster. If you could all, I'm sure you all know, at the moment it's rainy season in Gambia. It's peak time for malaria. Malaria kills a lot of people, a lot of pregnant women, a lot of kids, a lot of elderly people, a lot of youths. So that coupled with this is serious. So, the health facilities need to be protected. When I say that, what I mean is they should close down non-essential services and have stringent measures on access to these places. So there need to be proper triaging and tracking of people. You go in through one door and you come out the other end. If you got it, you don't go to the other side. The whole areas where I work were sealed off completely. So there was no access for people to test it. Mass testing is also helps, because if people have it and you've been in contact with them, then that means you need to shield yourself for at least 2 weeks. There's a whole raft of things that you could do to mitigate the situation. But once you've got this, it's not treatable. So it will kill people. So at the moment, it looks like the system is overwhelmed. And, to start with, before it got to this stage, it looked like the government has got some sort of grip on it. But at the moment, that is not the case. That is not the case at all. Where is all that money gone? It's no good having food when when you can't breathe. You're not going to eat it. So this kills people. So there's a whole lots of things. I think we need to collaborate with Senegal and any other country, for that matter, that can help. And the health promotion side of it needs to be ramped up. The leaders in our community, not only just political leaders, but also celebrities, the musicians, people like that need to come out and try and get people to comply with these whole promotional advices. So I think I'll pass it on, have someone else to digress a bit more on this.
Yeah, thank you very much, Ebrima. That's for that brilliant presentation, and also specific to the points. I will come back to your point. But Banka, our next question is coming to you. But before, when I speak already, is we talk about the government, lack of leadership. But what can the citizen do? Individual responsibility to make sure that we help the situation. We are not. But before that, the medical strategy we can use to help the situation, according to Mr. Suwaneh, and these are well-established facts. Regular hand washing if you wash your hand anytime you come into your house, anytime you shake a hand, you are more likely not to contract this virus. There's well-established research. Even before COVID-19, regular hand washing alone can save you from catching pneumonia up to 70%. And also, if you call yourself, our prophet said,
sorry to interrupt. If I may add, one
yeah,
other
so,
very important element of this COVID-19 situation is the viral dose. So, like I said, people catch this illness and some people manifest very mild symptoms of it. They don't get ill with it. It's like flu-like symptoms, and they get better. You test them for the antibody. I've had my antibody test, and it came out negative. And I believe I had it. I had the symptoms during the peak of it, but my antibody test has come negative, and I did the test that's come negative as well. But what I'm trying to say here is the viral dose is crucial to how bad you're gonna get this illness. So which in layman terms is how much of exposure you get to this virus will increase your chance of getting ill or very ill with it. So there is vulnerable groups in our societies. There's a lot of diesel cars, dirty fuel cars in the Gambia. These have heavy metals in them, in their exhume. So people breathe this. You go to places like Serakunda and Brikama, they're so saturated with traffic and people. I'm not surprised these are the cosmopolitan areas for a start, but I am not surprised these are becoming the epicenters of this illness at the moment. But it's really important you limit your exposure to this. It looks like it's almost everywhere. I don't know how the Gambia government, with no laptop to gather information, and also with only 3 ventilators, can solve this problem. They can't. I mean, that's pathetic. A whole country can't have more than 3 ventilators. This is a crime, really. So something needs to be done. We need to start making noise and make these people to do what they're supposed to do. There is politicians. They will always do politics. That's what they do. But there is technocrats who, like I said in the beginning, they look like they were doing things the right way, but there is always political meddling in the Gambian systems. We've got systems, they don't work properly because politicians meddle in it. Somebody commits a crime, their dad who's for example, just for argument's sake, a minister will join in and this person will get released. These sort of things need to stop. If you want things to work properly, you have to let the institution and the do their job. So then people, they're going to get involved. So they don't do the job because there's no point. You do it once, someone else interviewed the second time. What's the point in doing it the third time? Because, you're going to get exactly the same conclusion. It's human nature. But viral dose, to keep it short, is really important. It dictates how much, whether you will get it and how badly you get affected with this illness.
Thank you very much, Ebrima, for bringing that on. We call it infective dose in microbiology, that you need certain number of viral particles, whether you'll get it or not. So this is where super spreaders came in. These super spreaders, still the scientists are trying to describe what constitutes a super spreader. Somebody, wherever he goes, he spread to more people than anybody. And mainly, they are more efficient in an enclosed system, like in a hole, like a religious hall. For example, if an imam is a super spreader and he come and lead the prayer, he is reciting at the top of his voice, or a church choir, the singer is singing at the top of his voice. He's spreading more virus than. So it's completely different, like somebody singing in Serekunda market. That is an open space. So your chances of getting it reduces. So that's what he's talking about. But preventing it, washing hand, any kind of soap. It doesn't have to be any fancy soap. The soda safuno in the Gambia will be equally effective. Basically, what the soap does is it weakens the viral code. It just dissolves it. So that's why they say minimum of 20 seconds or 30 seconds. That is enough to destroy the virus. If you don't have that, you use alcohol hand rub. And talking about cleanliness and also hygiene, proper respiratory tract hygiene. Your Prophet Sallallahu Alaihi Wasallam said half of your iman is about cleanliness. So he talked about this hand washing and all that 1,400 years ago. And there is a particular incident about lockdown and also not going to places where there is a pandemic. When this was Omar's time, you know, there was a commotion in Syria. They need to go in. There is a problem, but they went in up to the outskirts of this particular city, and they were meet in the outside of city that there is a pandemic. You know, Omar consulted his compare. What can we do? You know, but majority decided, you know what, we need to go back. When he decided, okay, we go back, one of them didn't like that. He said, Omar, so you know, you are going against the will of Allah. That means we come up to here and you are decided to go back. Omar tell the guy, you know what, we are going back also is on the will of Allah. Then in that particular moment, one of the Sahabas remember this particular hadith where Prophet Muhammad tell his followers that if there is a pandemic anywhere, don't go there. And if you are in a place where there is a pandemic, don't move away from there. So this social distancing and lockdown was actually well established in the region, because some of these ill-educated Islamic scholars, this is what they call that, well, how ibe jamo kulos la no nyadi. But these were jamo were closed, just send you. If there is too much rain, they ask you to pray in your home. If it is too cold in Medina at that time, the Prophet will tell the caller to the prayer that tell them to pray in their houses. So take religion out of this. The other thing he mentioned the lockdown and also the viral dose. And now the politics, we're going to go, we cannot take politics out of this, and we mention it. But now, coming back to the citizens, the people who are affected, Banka, what can the citizens do to make sure that...
several things the citizens can do. One is to embrace the Senegal idea. I mean, because I think, you know, this idea that we don't need Senegal this, we don't need Senegal that, is so ridiculous, it's not even funny. Because if Senegal has the solutions, that they are already, in other words, they are proven solutions right next door, I would think that even the government will be going to Senegal and begging on their feet, on their knees, Senegal, please come help us contain this thing. Because Senegal has already done something that apparently works. This is how we do. Even Italy, you all saw in the news where you saw Cuban doctors in Italy. Cuban doctors in Italy. I mean, you look at the two countries, their GDPs, but yet doctors came from Cuba to go and help Italy. So, and the Italians were not too proud to you know, to say, oh, we are a first world country, so we are not going to accept that. They in fact accepted it in grace and publicized it and let the whole world know that Cuban doctors are in their country to come and help out. What is so special about us that we don't want we find it really abhorrent for Senegal to come in and help us? If the Senegalese are listening and watching us, I beg them, please come to the Gambia and help us contain this madness. That's what I'm saying. Number two, look, chances are the people that are watching us here already have information to a lot of the guidelines and, you know, WHO guidelines and stuff like that is out there about this virus as to how to avoid it. So I'm not addressing those people. What I'm about to say is to really tell those people what they should go tell their people back home. In other words, you have your mother at home who doesn't have access to the internet, doesn't have access to the Facebook and stuff like that. That mother who doesn't have access to information is the one I am worried about. One, she's in a high risk area in our group. And number two, she doesn't have access to all the valuable information. And number three, so there are things that are happening around her that she doesn't even have a choice to avoid. For instance, my poor mother is at the house, is home, but she cannot even stop people from visiting her. These people show up unannounced without even, you know, Gambia people don't call and say, hey, I'm coming there. They just show up. You know, this is what's going to happen. So what I am doing, those are the folks that I'm really, I want to give the pointers that I'm about to say, is for those who are watching us to take these pointers and transmit it to their families back home, in their communities, in their homes. Number one, look, if they don't have, if your mom doesn't have, what do I call it? Face masks. Yes, face masks, people are buying them, and maybe those who cannot afford them. But everybody has this. My mom always is covered. You know what? Use this and tie it around your nose.
But that's doing demonstration now.
That's you literally are covered. You know,
You are effectively covered, yeah.
yes, you are effective. So you don't need to go out there and worry about whether you have access to face mask or whether you can afford it. If you cannot afford face mask from the shop, by all means, you all have, our moms, our sisters, everybody has these things. Let them wrap it around their nose. This is what I told my mom. I said, look, at the moment visitors walk into the house, take your muso, your and just wrap it around your thing, your face, and let people. Everybody will understand these days. They all know that that's not because you are, you have a feeling about them. It's just that you are trying to avoid, protect yourself and them. Because if you have it, then you wouldn't give it to them. And that's number one. And this is very critical because the face mask, it seems, is where the emphasis is being put now. And so if you cannot avoid social distancing, which is very hard to avoid in the Gambia, let's admit, people, if you don't go to people, they will come to you. Fine. Get anything that you can get and wrap it around your nose and mouth and all these areas. Even if you can if you can put something on like eyeglasses to avoid, protect your eyes, by all means do it. In times like this, these serious measures are needed. And also, like Manjang, you just said, and Sawaneh, alluded to, by all means, let's wash our hands consistently. That cleanliness is needed in all the religions. They all advocate for cleanliness. Wash your hands, wash your hands, wash your hands consistently. And in this going to Juma prayers, this idea, even Mecca is closed, is shut down. So this idea that Islam is the one Islam said, the Quran says, that's nonsense, because we cannot be, our mosque cannot be more holier than the Kaaba. And let's be honest, that's not the case. So if they shut down the Kaaba, what makes you think that your mosque is so holy that you cannot avoid it? So let's avoid those kinds of gatherings. The kulios. These kulios are, yes, they are great, but this is not the time for them. Kulio can even be postponed. Postpone it to post-COVID-19. When COVID-19 is contained, yes, you can have your big gathering and have your big kulio and let's all celebrate. But this moment is not the time for it now. And Islam doesn't even mandates you to do it the way we do it. These big gatherings and having all, that's not what it says. Have somebody, religious leader, quietly come to your home with all the protections, let them perform the ceremony and go home and tell everybody you are postponing it until after COVID-19. All those big social gatherings, attire views, all these guys that think they need to continue to hang out around each other, by all means, if the boys come to you and you cannot avoid them, put your mask on and insist that each and every one of them put their mask on. Those who don't want to put their mask on, let them go home. Period. In other words, let's not take any chances with this. So those of you who are watching us, go back home and communicate this message to your family members, your friends, because it's about life and death. People are dying all around you. All those people that are quietly dying and you don't know why they died, all of a sudden, it's COVID-19. COVID-19 is what is killing them. Whether they admit it or not, whether they say it or not, whether they know it or not, it is COVID-19 that is killing a majority of the people in the Gambia, because they will talk to these people and they'll say, well, it was just, it was just a little flu that he had. The next day he died. Well, like,
we lost that.
Yeah, we're back.
That's what happened if you agitate the nyanchos,
But anyway, I got kicked out, but I'll leave it there to let others to come in and speak about this, because I think
today you just touched on something there which I'll just very briefly mention. You mentioned about attire booths. I think attire should be banned for the moment, because attire, they're not very hygienic. You share one tiny cup with 5-6 people.
Yes.
So you basically eating their saliva, whether you know it or not.
Yeah.
So this is not a good idea at all to drink attires. It will just spread it like wildfire. That's all I wanted to add to it.
Thank you very much for highlighting that, Banka. Thank you very much. Basically, what Banka is challenging right now, we have 55 people watching this. Banka is challenging you. In fact, it's 60 now. You go and speak to 5 people who you think might not have access to internet, or even if they do, speak to them about the information they have there. That is 300 people. And challenge them to go and speak to another 5 people. That is 1,500 people. If we all do that as citizens, then we have all the right to hold our government to account. But there is no point holding our government to account, but when we refuse to do our individual responsibilities. It doesn't work like that. The president, it doesn't matter how effective they are, they're not going to come to our houses to make sure we maintain physical distancing in our house. They're not going to our houses to follow us if we wash our hands regularly. These are individual responsibilities. That's what Banka is mentioning. And also spreading the information to the people who need to hear it. So that is that. I'm going to Dave now, then I have Prof, and this will be the final rounds of our conversation. Is really, really, really interesting. And also, before I go, Banka mentioned about religion again. Almighty Allah speaking to the Muslim, the Muslims, those who not only Muslim or human beings. Sometimes he will speak to human beings. Sometimes he speak to Muslims. But he said, Ya ayyuhallazina amanu wa atiullaha wa atiu rasul wa ulu amru minkum. If you follow Allah and His Prophet and people in authority among you, but who are these people in authority among us? If I need to speak up, if I have issues about accounting, I don't go to the Imam. I go to Dr. Conteh. If I have medical question, I go to Mr. Sawaneh. That's what the Quran is telling us. There is no higher authority than WHO. So if they advise the Kaaba should be closed, that's what the Meccans are observing. That's out of their hand. And that is not from them. That is from Allah. People in authority. Who is in authority about health is the WHO. There is no better authority. You go to the Gambia, it's the Ministry of Health. If they advise, do this, close your mosque, close it. If you don't do this, you are doing something that's un-Islamic. We have to understand that. So we cannot base this on religion alone when imams are coming with fatwas that they have no idea about. When it comes to health issues, imams should step aside and listen to medical personnel. When it comes to politics, we leave that to the Khalifa Salas of this world. They teach us how politics works. So this is the situation. Thank you very much. Dr. Dave Manneh, what have you got to add to that? What we can do as citizens, to make sure that we get out of this, because we are in real trouble, and Gambians should understand that Gambia is in a situation where I believe 100% we cannot pull ourselves out of it.
Yes, thank you so much to my dad, to Ibrahim, and also Dr. Conteh and everybody, and yourself, obviously. In my own little way, this morning, I took it upon myself to send voice messages to, WhatsApp groups in Bakau from my mom's side. I sent them a voice message, basically telling them that we're very concerned because we see the devastation that's been wreaked here, and the UK compared to the Gambia, obviously. So if we can do the damage it did here, only God knows what could happen in the Gambia. But just to emphasize what Ibrahim said, wash your hands and just follow whatever you guys have said, really, basically that. And then I send it to my group in Yundum people. I'm also in a group there. I send it to those family as well. I send it to my Mani Kunda family in Bufudu as well, in the clan, the Fasi Kunda. Send them some stuff all about this, washing your hands and practice social distancing. So, but then today I was actually quite impressed. Somebody forwarded me a voice message, and it was from my childhood friend, Babuka JT in Bufoot. And he mentioned something which it was an oversight, actually. Because it's not only in Bufoot, it's all over the coastal combo, where we have Senegalese who will come over, and that from the Lebos and what's it called, Lebos, and people from the other side of St. Louis. They will come to Gambia. They live with us, but they will always go home for Eid. That's just religion. They always live with us, but normally they'll go back to Senegal for Eid. And apparently, they obviously they take the boats that they sail from Gambia, from all the coast, from Kartong all the way down to Bijilo. Really, he's always been with us for years, for generations now. So he just mentioned that lots of them had gone back to Senegal and they're coming back. And then so he was calling on people in Combo. I'm very impressed by Babukar. Well, I should be surprised really, because he's a community activist. But I was very, very impressed today. Very impressed. He just basically reminded everybody, these Senegalese are coming. They are our brothers, they are our sisters. They live with us. But when they come, we need to make sure that they get tested. And I think that's very important. That's a very important message. So for people like us from the coastal region, like my dad said, we can tell our moms to cover their faces. They got their musoro or atolu, what's it called, tikolu. Yeah, but then again, this community message of passing it out, like you said, it multiplies. You speak to 5 people, they speak to 5 people, they speak to 5 people. We got multitudes before you know it. But our people also don't listen that much in the Gambia, unfortunately, because you can say the government did try. You could give them that. It's poor governance, it's poor administration, but they've been sending out the messages there. It's not been enforced. Some people also need to take responsibility for themselves, not only for themselves, but for people around them. So don't come and visit me. I don't need you to visit me. Just call me. And that's exactly the messages I send to my people today. These family groups I'm in, because these are all very vital to me. That's my mom's side for Bakau to Nyomi people, my dad's side in Brufut and others, and then in my Yundum family. I send all of them the same kind of messages. Yeah, so it's very important. I think we can all do this in our own separate ways and family groups and others. I think it's quite important.
Thank you very much, Dave. Nobody will be that much talk about this, but unfortunately, our president is positive. That's the news here from Maham Lamin Kui. Fatu Network is reporting that President Barrow is tested positive. So, it's always going to come out. It's just a matter of time. So this is serious because this man weight alone is a confounding factor. It's a comorbidity as far as COVID-19 is concerned. And most of these ministers anyway, because once they hold this position, what they do, they go and get themselves a second wife. So basically, these wives will compete in feeding them. They end up piling the pounds. And that's a problem. This what worried me when I hear this. All these government ministers are getting positive. Weight is a significant comorbidity as far as COVID-19 is concerned. Prof, you have the floor. Now we are talking about what we should do, but now our president is positive. What's your take on that?
Well, that's a very serious case,
Yeah,
and
it's really serious. May Allah give him
we wish him a speedy recovery. But last year, when I was in the Gambia during Tobaski, most of the shops were empty because most of the Senegalese went back home. I'm wondering how about those coming through Bara at the checkpoint in Hamdallah? Do we have any one station there testing machines to make sure that these people don't have COVID? And also, as they board, the ferries going down to Banjul, do we know whether they're going to be infecting other people? So yes, the president has been tested positive, and what should be the next thing? And you know that Barrow has pre-medical condition, and we don't know what's going to happen. Let's hope for the best. But again, you said something. Those people who travel through using the boat, to Senegal and landing in Gunjur and other areas, do we have any custom officials, medical people stationed there to ensure that these people don't have the virus? So I am very concerned about the villages because at least if you are in the city, you may have access to transportation to go to a clinic. But if you live in other areas, because you read the number of infections in Combo South, Combo North, and North, and Combo Central, but I didn't hear anything about my my little district, Combo East, and going all the way down to Fonyi. So this is something that I think we need to come together. But I hope the powers to be are listening to us, that they should come out and uh, show us some form of direction. And someone even said that when the late football player Berry was buried, uh, because I even said that why would they take him to the National Assembly during this time of COVID? That we're going to have some infections there, and I was right. So again, what the Islamic culture says that I guess when you die and they're going to bury you, the more people they see, the more impressed they are. But today is not a period, that we should look for that. So We hope, because I don't know whether you all saw Rahim Malik Low crying. And if you haven't, please go to my wall. You'll see it there. And it's very, very, very touching. And she said that she goes from one funeral to another. And I'm actually even concerned about her myself, because if she's going in to get into somebody's house and sitting with people, mingling with them, do we know whether she also has it? I don't know. So again, I want to end this by saying that, a beggar should not be proud. So if we need help from Senegal, I think our government should reach out to Senegal to save lives. And this might even affect Barrow's re-election, because Gambians will never forget that we have a president during the time of our crisis hasn't said anything. He's mute, and that cannot continue on. So we need some form of action. Today we are no opposition. We are no pro-government. We are no independent. We are Gambians, because seeing the mayor of Banjul crying, I don't care which political party you belong to, you should have some form of emotion for her. And it's very sad. People are dying. And there has to be a way where we can minimize such things, especially people who even are dying in the compounds. Folks are scared to even go and get them. It's very troubling, and let's hope the best for our country. Let's hope that this disease or this virus that's going on is conquered, and that we can get back to normalcy. Thank you.
Yeah, thank you very much, Prof. I forgot to highlight something very important Dave mentioned, that is the Senegalese visa folks returning back to the Gambia after the Eid. Again, that come back to lack of leadership. The select committee, parliamentary select committee that was selected to monitor the effectiveness of the SOP, strongly recommended that these fish meal factories should be closed immediately. They were never closed. When you see this, I just text to their chairman and remind him who is responsible of enforcing that law. Because what happened, this fish meal factory contracted these Senegalese fisher folks, that they will be supplying them fish. So if they are not operating, they will actually go back. And what is significant about that, if you look at Senegalese numbers and their regional infection rates, these major fishing communities in Senegal, where most of these fishermen come from, are the most affected. So they're going to come back and flooding back to our community. And coincidentally, earlier today, I was talking to this British lady who called Gunjur her home for the past 15 years. Is worried about this because he lives along the beach and is living in a community where most of these Senegalese people live. So we were talking about forming a community action group. I think we should suggest this, whereby you have group of committed youths, you teach them how to observe this social distancing. They can go around. If they find group of people not observing any of these rules and regulations, they can remind them. If they insist, they call the police, because the police can be everywhere. They can, if they hear that there is a christening ceremony somewhere, we supposed not to be having christening ceremonies now, they can tell them to disperse. If they don't, they call the police to come here. So we should suggest this to our communities. When we have this youth group, they go around, because there is no school. The university is closed. So everybody is supposed to be at home. So this is a way of engaging the youth to make to complement government efforts. Mr. Suwaneh, Banka will close it today. What's your final take on this? Now that the president is positive, I'm going to use this opportunity to pray for him and all those who are infected, not only in the Gambia, but across the world, to get well soon. But what's your take, and what can the citizen do?
Well, this is a serious matter. Obviously, we're in trouble, and I can only wish the affected people all over the country, starting from the president to his ministers and everyone else in Gambia, to pull through this troubled time. It is difficult. We've had our peak in the UK, and our prime minister, notably, was infected himself, and several high-ranking government officials. So this is the thing with COVID. It doesn't know any social class, and anybody can catch it. So it's really, really important we stick to the international guidelines. These guidelines change constantly. This disease is new. We're still discovering new ways of dealing with it and how it evolves. So we need to listen to the experts. You need to listen to the experts, the doctors, the healthcare professionals, and comply with their advices. So the social media channels, like yourself, Gunjur Online, you have your Power Modus, Fatu Network, and many, many, many others. Sorry for mentioning other rival um, media channels on your show.
No, we are
Oh, it's
not
not
rival. We
rival.
are a community. We are a community platform. No problem.
But basically,
So
every
maybe mentioning their name here will uplift our profile anyway.
so they need to be engaged. They need to be involved. Like I said,
Yeah.
the celebrities, people on the spotlight. The president himself, he's close. Like prominent people in Gambia. They need to show interest in it. They need to show concern and compassion. That will probably help galvanize the masses and move people towards compliance, because we all know there is no compliance in Gambia. Our borders are porous. You've mentioned about the fishermen, the levels going in and out of the country. These all spreads. It was worse in Senegal, and now it looks like by proportion, we've either caught up or maybe we've surpassed them. I am not exactly entirely sure about the statistical comparison in this in that sense. But wash your hands, wash your hands, wash your hands with soap and water. Any kind of soap is good. Just wash your hands after contact with anybody, because and also avoid people who have flu-like symptoms. People with cough, with headache, with sneezing, runny nose. People are try and avoid contact with them. In fact, the advice is if you come into contact with people like that, you need to shield yourself. You need to isolate yourself completely in your house. Don't go out for 14 days, 14 whole days. Your family members, if they don't have any symptoms, they don't need to be kept away from you. But you need to seal yourself for 14 days. If you have it yourself, the symptoms will show on you, and in which case, you could seek treatment if you need it. But this is really important. So social distancing, hand washing, don't touch your face, wear the personal protective equipment, face mask. When you go out, it doesn't have to be anything fancy. These are droplets, so it's like aerosol. It's like a spray in the air. This mosquito insect sprays. It comes out in vapor. It's like droplets. So it can come in big droplets, little droplets, micro droplets. So if you wear a face mask, it will stop it from percolating through it into somebody else. So wear a face mask, improvise if you have to. I've seen videos on social media, people improvise with tissue papers, with socks, anything. Use your collars, cover your face. We have to reach out to our vulnerable people, our elderly people, our people with asthma, and people who are obese, morbid obesity. I will give you this personal experience. I have been in contact and I've looked after a lot of people who have had COVID-19 in ICU. But I'll tell you this experiential fact, which is every single person I have seen in ICU are obese. They're all fat, especially around the tummy area. So obesity is a compounding factor. It makes you more susceptible, and obviously they end up in that more serious category because they are the ones I have seen in person in ICU environment. A lot of people don't reach that stage. They get better before they get to ICU. So you know, eat well, watch your diet. It might be too late for people who are already obese. A bit of exercise, your lungs, and also this is the treatment we would use in ICU. I don't know if they practice this in Gambia, but it's really useful for for people who are seriously ill with COVID-19 to nurse them face down, lay on their chest. You know, you could put some pillows, you go face down. The importance for that is when you're in that sort of position, you use different sort of muscles to help, accessory muscles to help you breathe, you know, because your muscles, when you labor breathing, your muscles will get tired, and if anything get tired, it can give up. And if these tissues give up, you know, you won't be able to breathe properly. You might stop breathing, you know. So is this does help, you know, but you need to change positions to give chance for different muscles of um, your chest to work and help you breathe. You know, so that's really important to seek help if you need it, but we need to try and avoid go to hospitals in Gambia, especially I'm talking in the Gambian context here. If you have malaria, it's malaria. From my experience working in the Gambia, which is decades ago, is really easy to treat if you seek help early. So what I tell people, what I tell my family back home and people I know is, if anybody who has malaria type symptoms, treat it for malaria, which is if you have headache, there's mosquitoes present, you have headache, you have temperature, take malaria treatment and complete the dose. The dose, complete it. Don't take it half and say I feel better and stop it, because that creates resistance to that particular drug. So if you have these symptoms, go to pharmacy or send somebody to, because you could do this in Gambia. In the UK, it will be need to be prescribed. But from my last experience in Gambia, anybody can buy these drugs at the pharmacy. I don't know if the situation's changed, but get somebody to get you a course of malaria treatment and take it in totality. So at least you rule out malaria, you know, and don't go to hospitals unless you absolutely have to, because the danger is if everybody starts going to hospital with mass or any health facility with mild symptoms of COVID, what will eventually happen is they're going to eventually infect all the healthcare workers. And as you can imagine, if all these healthcare workers who are supposed to treat people who are ill with COVID, because we know COVID's there, we probably have not reached the climax yet. It seems to be going up, so we've not reached the peak. So what will happen is the health system will collapse because there won't be enough people, enough well people to treat these sick people. So you need to protect the healthcare workers and not go to these facilities unless you need to go there. I am not saying don't go to hospital if you need it, but if you have headache or malaria, you know, you have mild symptoms of anything, seek advice first before you rush going to these areas, because it will spread it. It will make it worse. The healthcare workers will catch it, and then eventually there won't be enough people in these places to treat these people, which will lead to a total collapse of the system, and that will be an absolute disaster. So thank you very much, Dr. Conteh, Dr. Manjang, and my friend D.F. Manneh is my childhood friend. I've known him from you know, years and years ago, you know, when we were little boys, shall I say. And thank you very much, Banka, for having me on this program. I appreciate it very much. This is my first time ever to do this kind of thing. I have to say I was quite nervous at the start, but I'm beginning to ease in now. Now we've reached the end of it. But you know, I appreciate you know, it's useful. We need to spread the word and the message. People need to comply and follow healthcare workers' expert advice with this, because it is serious. This, you know, I'm sorry to say, it does kill people. I have seen it kill a lot of people, and I've seen people affected with it. I don't want to sensationalize it, but you know, we probably have to shock people to get them to comply. And if that's what it takes, shock people, show them dead bodies to make them comply. If it saves a life, I think it's worth it.
Yeah.
So thank you very much for having me on.
Yeah, thank you very much, Ebrima. You did very well. You don't look like a novice. Yeah, you know, you look like a real veteran. Let me tell you one thing. It's good you advise people not to go to hospital. I can tell you the Kombonkers have already decided the hospitals. This is not a joke. Nobody is going to hospitals now. This nurse is telling me, Gunjur, you'll go the whole day, say only 2 people. So people think they go to hospital, they get COVID. So with all this bravado, you don't believe it, they are scared to death. So it's good that you mentioned that. If you don't have to go to hospital, don't go, because places like RBT, under normal circumstances, that facility should be closed completely. Fumigate it, for a week, clean everything, and bring back only those without no COVID. And you have a special treatment facility for COVID. This is a problem. Getting COVID out of RVTH now is one of our biggest challenge. And I can tell you our healthcare system is already broken. I'm not so completely, but it's collapsed, because they can even update their website. It's down for 3 days now. We don't know the numbers. And if MRC is having like 32 of their staff infected, 65 of public health laboratory are in quarantine. Some of them, about 20 or so, are infected. So that's why our testing capacity is almost done. And one of the issues they are lamenting about is lack of electricity. Like a PCR, they will start a PCR 1 hour, the last minute the current will go, that you have to start all over again. So this is waste of resources. That is in their minutes. You read it in their website. That's a problem. So it is now they are thinking of bringing in solar panels and UPS. Could you imagine? They don't have all that. Where have the 500 million or the 1 billion gone?
It's lack of planning. I have to say, I think it's basically lack of planning. The key to any successful intervention is careful planning. I have to say, where I work, again, I keep bringing, because that's what I know. We had almost a military style planning about a month before we get to this. People were informed. We were drilled into doffing and donning, what we call doffing and donning. This is how you wear protective clothes, where you wear it, and where you take them off. So these areas are all segregated. All this helps. It helps contain the virus at a certain area. Like you said fumigating. We say deep cleaning. You can deep clean it with chlorine-based detergent, because they generate a form of aerosol. So if you use that sort of cleaning material and clean a room, the walls, the ceilings, the windows, the floor, the door, everything, all the equipment in there, you could use it within 24 hours. You don't have to wait for a week. So I don't know whether we have those facilities, but what I know is a lot of these rich people in Gambia have swimming pools, and there's a lot of chlorine in these swimming pools to keep them clean. I mean, we need just a little bit of innovation to work these things out. It's not really that difficult. You just need a bit of innovation and commitment, and a bit of foresight, leadership. We could do so much, but we've done so little. Is that?
Yeah, thank you very much. I apologize because this is supposed to be 1.5 hours, but it's 2 hours. 2 minutes before 2 hours. So Banka, please close this. And it's just so this was probably one of our best decisions to call, and it's well watched.
Absolutely.
And depending on what happened, we might continue this next week again, because this is the burning issue of the country. And that's how countries work. What we are doing, actually, we are providing that leadership that is lacking in the Gambia. This is a very good time for once our opposition to bury their hacket and come together for the common good. But it seems everybody is in their corner, either it's ego or what. But this is beyond battle. This is where our veteran politicians say, you know what, we need to come together and find a solution to this. Maybe it's beyond the government. So what we are doing, you've seen it in the weeks. Banka, you are a regular in the social media. We are directing that government what to do. You said something, it go viral. Next thing you see, they're doing something. So we hope they will take their course, because very, very important informations were said here and discussed here, and we provide solution as well. So you can close this program for us, and thank you once again for your time. We really appreciate it. And our viewers also, we really appreciate your time and your insightful comments. These keep us coming. These keep us going, and it directs the trajectory of the discussion. Thank you.
Well,
Banka.
thank you very much, Ahmed, for the brilliant job you've been doing, really hosting these events. And to Sawaneh, thank you so much. I mean, because I'm sitting here and I'm like, he better not stop. Keep going.
Yeah,
Because I'm learning so much from you. Yeah, and my son, Dave, I mean, you obviously always make us proud with your direct and to the point issues that you raise. So we really appreciate it, because this is time to speak out and really lay it all out there, which you are doing a brilliant job in doing. I cannot be much prouder, to be honest. Doctor, here you are once again. You were telling it like it is, and this is a time for truth telling to power and to each and every one of us, and you are doing such a brilliant job with that. We're going to just have to keep pushing these things, because in the end, the government, the leadership, I mean, what we have lacking, and if you go back and look at COVID-19 throughout the world, there's a difference in between the countries that have failed in containing this virus so far and those who have done a good job in containing it. And there is only one significant difference. Nothing else. It's called leadership. If you go back and look at the countries where this virus has been brought under control, no matter how difficult it was in the beginning, it was in their leadership. The leadership stepped up and it did what it had to do. And New York City, for instance, Governor Cuomo, you go to even Italy, it was a mess in the beginning. But when finally the leadership stepped up and did what they had to do, they do a good job with it. You go to Germany and all these countries that people are really, New Zealand, that people are crediting the country for doing such a wonderful job in finally containing the thing. You go back and look at all of them, they all share one little strand in common, and that is they had a leadership, or they have a leadership that stepped up and did the job. In America here, we are still struggling despite our resources and our power, superpower status, and all these things, because we lack leadership. And the same situation is what actually obtains in the Gambia. What we have in the Gambia currently, the problem that we are having with this disease is the lack of leadership. Macky Sall provided leadership in Senegal. They've been able to deal with it. In the Gambia, Barrow hasn't offered leadership in this. In fact, he has outsourced this problem to other people. Most of the time, the Minister of Health was the one that we've been seeing out there. Yes, he was trying his best, but he is not the president. He cannot move certain things. He cannot do certain things. In fact, most of those things are not even under his purview. So the president, and only the president, can take a hold of these things, because he is the one who has to provide the leadership, push all the elements, make sure all the troops are in place, rally the people, energize them, and galvanize the people at the grassroots level, and together we all move in the same direction. But if that leadership is lacking, we'll run into a problem. So as a closing remark, I'm just telling, what I want to say is to tell Barrow that this is very, very important that Barrow steps up and provides leadership. Now, maybe he has COVID-19, because I'm hearing reports of that. If that is true, speedy recovery to him, we hope it gets better. But still, what he needs to then do is to designate somebody credible, somebody who has the wherewithal, who has the guts and the willpower to do, and the ideas to step up and provide the leadership for the country in this moment of need. Let him not be jealous about this. He can hand this thing over to somebody. I'm not talking about the presidency. I'm talking about leadership. There's a difference between the two. We need leadership on this issue. Let him hand over the leadership to somebody credible, and give him all the tools and the powers to step up and do what needs to be done right now, because this should have been done months ago. But right now, because this is very critical at this point, if we continue on this track where people don't even know who is in charge, where people don't know what direction to go, whether we hear about state of emergency today, the next day it's not. You impose a state of emergency, still people continue to do what they were doing, like there was no state of emergency. These conflicting and I would say confusing processes where people don't even know what is and what is not. We cannot afford to have this anymore. We have to have clarity, and it has to happen through communication. It has to happen through leadership. Most importantly, if we don't, we are doomed. This thing, what they call the genie is out of the bottle. We are on track to become one of the worst cases in Africa or in the world when it comes to COVID-19. If you are testing 60 people and 30 of them are coming back positive, now that is 50%. That is not good. That is really, really, really bad. That 50% rate. Now, I'm not a mathematician, but I think that should give everybody an idea of where we are heading with this. So please, let's have the leadership. Let's get it stepped up to the plate. Let's do what we need to do to deal with this mess. Otherwise, we are in big trouble. By the time we deal with it, we would have lost so many people. Our productive force will be so depleted. Our cream of the crop will be so, I would say, eliminated or obliterated, that I'm telling you, it will take us another generation after generation to actually be able to get back on track, not even on the COVID end, but on even development and economy and otherwise. So it is very, very important that we step up right now at this moment. That's what I wanted to say.
Yeah, thank you. One generous viewer said this about you, the panelists. What a great discussion. True, what you are saying is about leadership. You guys are on top. Keep up the great work you are doing. Banka, you mentioned Genie. That's one Genie out of the bottle. One of the Jame treatment option is Genie, for HIV. Thank you anyway with that.
Thank you. What a great note to finish it on.
Exactly. Thank you, guys.
Thank you so much. Hey, Sawaneh, I'm proud of you, brother. I'm going to phone you in a second.
Thank you very much.
Thank you.
Here are 5 ways you can help combat stigma and discrimination as we fight against coronavirus COVID-19. 1. Educate your friends and family that COVID-19 is not specific to any race, nationality, or skin color. 2. Do not associate migrants with the virus. In many contexts, migrants are healthy and key players in nation building. 3. Remind others that discrimination may lead people to hide their symptoms rather than seek treatment. This puts everyone else at risk. 4. Be kind, considerate, and helpful to others in these difficult times. 5. If you know anyone experiencing symptoms, encourage them to dial 1025 for free.
Lulolti isi fam mako eno foi si tanka kaja fo ning fatan fansola pour que ñun corona jangaro kele bunda folo ela ka fuñol ni la dimbayal kala mutandi ko ñun corona jangaro bu ka jibe e musi jumalati warande ibota banku jumaleto walla e bawro la kurorom kurola jumalati bunda fulanjang ikanaje ko tamalal dam male ka ta ñun corona jangaro soto fanna jama ya itandi le ko ñin tamalal jama jaato kende yatale andum ka kataku jamale ke banku do ko kono bunda sabanjam mol hakilo bulandi ko ño kaja fo ning fatam fanso satin nanni nole fan fo modol sila kurango mabo puli kanata jaaroro la andum ñin si mobe dundi no mantoro kono le bunda nani njang al nga bala fa ñoye nga ñoma koy bunda lulu njang niye molo meye atenyum corona kurang la mandar go sodo afoye 1025 command andum ite fenjola
Kodiliko salamane. Nandele nakanobe.